This recreational vehicle on the side of the road is what research calls a life-saving tool. Inside is where drug users exchange their old syringes and get clean ones to reduce their risk of spreading infectious disease. There's also emergency medication for overdoses, free condoms, and a friendly face available to drug users. Advocate Tarryn says these people are too often dismissed.
They're able to go to a place for maybe only 3 minutes out of their week where they're not judged or stigmatized or stereotypes aren't there.
Can I get you some supplies?
Stamos is part of the county's initiative to eliminate hepatitis C. Estimates say people who inject drugs account for nearly a third of the county's hep C infections. Drug users may share dirty needles that can spread the blood-borne virus, which can cause liver failure. That's because sterile needles are hard to get without a prescription.
Using a syringe service program and clean needles decreases chances of hepatitis C transmission about 50%, and long-term substance use is actually decreased by engaging in services like this one.
She says distributing clean needles can help curb growth in the region's hepatitis C rate, but this syringe exchange has a limited impact. The team from Family Health Centers of San Diego is the only one in the county. A decades-old decision prohibits the programs, but Supervisor Nathan Fletcher wants to overturn that.
I would like us to have more of these throughout San Diego County. How does this work?
Fletcher, the county's first Democratic supervisor in decades, is challenging the ban, which has been upheld by his Republican colleagues. He says the exchange's health educators provide support and care that can motivate an addict to seek help.
People are 5 times more likely to get into drug treatment if they come to a syringe services program. And so we can't let optics or the way someone feels or the way someone felt 30 years ago stop us from doing what we know is the right thing to do.
Please welcome my friend, Tarryn.
Fletcher is proposing to add syringe exchanges to the county's harm reduction plan, and Stamos is advocating beside him. She knows the programs work. Before she was an advocate, she was addicted to heroin and meth, living on San Diego streets.
I would have never made it into recovery if it wasn't for syringe programs.
She traversed the city with her belongings on her back, including enough shoes to satisfy her love of footwear.
I give myself permission to have enough shoes to, my feet deserve it.
She says she found brief moments of refuge at low-rent motels and inside the Family Health Center's mobile needle exchange.
I wouldn't be here today if it wasn't for the staff and the lack of stigma and judgment that kept me coming back, looking for that connection.
But she says that opportunity was limited then and still is today. Users can only line up once a week at sites in 2 City of San Diego locations. The sidewalk operation in North Park drew a 21-year-old cashier from neighboring City Heights, but also a couple who drove from Mira Mesa and a 53-year-old handyman from Campo.
They have a resource that they know people here and they can talk to.
Stamos says she has people like these in mind when she advocates for better access to syringe services. She knows it's a long journey to get where she is now, a certified addiction counselor on the way to becoming a licensed clinical social worker.
I don't want to leave people where they are. I want to meet them where they are and help them to make any kind of positive change, and syringe service programs are a big part of that. They bridge the gap between chaotic use and abstinence.
But opponents argue exchanges make it look like the government endorses and facilitates drug use. Supervisor Diane Jacobs said that a decade ago. This time, 10 years later, Jacobs says she'll listen to the testimony and presentations at an upcoming board meeting before weighing in.
Can I give you this?
Tarryn, Mento, KPBS News.